For all Teams meetings, navigate to the ribbon at the top of the screen, select More, denoted by the three dots, scroll down to Settings, select Accessibility, click the button indicating Always Show Captions in my meeting, and this will allow for live captions to be shown in every Teams meeting that you join. We will put these instructions in the chat momentarily. If you have any questions about anything at any time, you can reach out to Emily, emily.greer@tn.gov, or myself, dawn.reed@tn.gov. Remember that the recordings of the Lunch and Learns can be found on the TEAS website, and I will also put that in the chat shortly, the link to the website. We ask that you only utilize the chat today to ask questions to the presenter or the host. No extra comments or chat amongst audience members, please. This is, again, for ADA accessibility. The presenters' emails will be provided, and you can send them direct emails to ask questions, or we will have a question and answer portion at the end. You'll be able to put questions in the chat that we will address at the end of the presentation, or you can unmute at the end of the presentation and ask your questions aloud. Today we have Catherine Williams with us again from TN STEP, and joining her from Family Voices of Tennessee is Chrissy Hood, who is a peer support coordinator, and Merritt, who is a parent guide with the Peers program. And I am going to turn it over to them now and let them start, and I'm going to get their PowerPoint showing here in just a second.
Thank you, Dawn. We'll wait just a moment on the PowerPoint.
Okay. I'm trying to work on that.
You are fine.
Give me just a minute. It is not cooperating with me, guys. Hold on just one second.
Dawn, let me know if you want me to go ahead and share it.
Do you have it?
Yep.
Okay.
This is what happens when Emily goes out on leave during a lunch and learn. Let me know when you are seeing it. Y'all seen it yet?
Not yet.
No, not yet.
There it is.
Okay. Yeah.
All right. Good morning. My name is Chrissy Hood. I am a white middle-aged woman with blondish gray hair, and I'm wearing a blue print blouse, and I'm here to speak with you about Family Voices of Tennessee today. Next slide, please. So I'm going to start by introducing my why and why I am a part of Family Voices of Tennessee. As you've seen previously on the introduction to today's presentation, we are families supporting families. The picture, the one big picture of my family, those are my three daughters and my son-in-laws. But the other picture of the young lady in the green dress is my daughter, Elena. And Elena is happy. She smiles a lot. She's a social butterfly. She's a people watcher. She really is a sports and music enthusiast. She loves her honey buns, but only Little Debbie honey buns. She loves to ride the escalators, and she really enjoys stickers. Yesterday, she was able to go back to her therapeutic horseback riding, which brought her the biggest smile. But Elena also has autism, cerebral palsy, epilepsy, severe intellectual and developmental disabilities. She doesn't communicate with her voice, and she has lots of medical diagnoses, and these are all caused by a rare genetic syndrome called Phelan-McDermid syndrome. Next slide, please. So who are we? Our staff and our volunteers all have personal experience caring for an individual with a special health care need, chronic illness, or disability. This personal experience helps us
I was like, where is Cersei at the baby cell?
So we connect families with each other and with community resources. We train families to become advocates and leaders, and we lead alongside families to ensure their voices are included, heard, and honored. And so I'm going to explain that just a little bit more. So we connect families with each other. Part of that is through our parent to parent. We do that peer connection. We connect them to community resources. So when we see that there are events or resource fairs or things coming up, we send those out to the families. We make that available on our website. We also send out emails just so that they know the things that are coming up, and we train them to be advocates and leaders. So an example of that is Disability Day on the Hill. We trained and held webinars where those attending Disability Day on the Hill would know what to expect on the day. We helped inform them of how to, one, schedule an appointment with their legislator, how to communicate with their legislator, how to conduct that meeting. And we lead alongside them to ensure their voices are included, because we know that lived experience is valuable, and we know that we need to hear from families to know what they're going through in order to know how we can help and assist them. Next slide, please. So our team, Ashley Siebers is our director. Her email is Ashley, it's Ashley_S@tndisability.org. Tanya Bowman is our family resource specialist and our statewide trainer. Her email address is Tanya_B@tndisability.org. I'm Chrissy Hood. I'm the peer support coordinator. Chrissy_H at tndisability.org. Leah Williamson is our peers program coordinator, and you're going to hear more about that shortly. And her email address is leah_w@tndisability.org. Next slide, please. Additional team members: Merritt is a parent guide, Dorca Rose is a parent guide, and Kanshunda is another one of our parent guides. Next slide, please. So why is family support so important? That family to family support so important. So here are just a few quotes that we have received. I so enjoyed speaking to you today. I need to hear another mother who might catch a glimpse of my heart. I did yours. ECF parent Kelly. Talking with another parent whose son has lived his life with the same diagnosis as my son meant so much to me. There is support out there. You just need someone who has been there to show you the way. Susan, mom of Sean. Being able to serve as a support parent to another family or be part of a committee working on ways to make our communities more inclusive and supportive of families and children with special health care needs is so rewarding. April, mom of Effie. So, and I'll tell you too that the American Academy of Pediatrics endorsed this parent-to-parent support as family-centered practice to improve the health outcomes for children and families. We know that, I will tell you personally, I navigated, Elena is 22, and I may have failed to mention that, but I navigated this journey alone. I didn't have that parent-to-parent support. So I know what it's like to feel alone, to feel isolated, and we don't ever want another parent to feel alone, isolated, or overwhelmed. We know that parent to parent builds empowerment and community. It reduces that isolation for the families. It provides a sense of belonging. It enables parents to feel more competent in their caregiving role. It gives them hope and practical tools for their journey. And we all need someone who understands what we're going through or who just gets it in our corner. Next slide, please. So how do families find us? A lot of times families find us, as you can see on the graph, the first bar says family, and between 750 and 1,000. That's our source for all of our programs. And a lot of families find us through referral from other families through that word of mouth. And then the next little blue graph is our healthcare professionals, and that ranges from 0 to 250. So that's on the very bottom. It's a very low percentage there. However, I will say, because recently in May, our team did a road trip and they went around and visited lots of the Children's Hospital, a lot of the rural clinics, and let them know that we're available and how they can help do a referral on our website so that families can get connected to us. Tennessee Department of Health, TDOH, is the next one. It's between 0 and 250. It's significantly more than the healthcare professionals. And the way that works is any child that is born in the state of Tennessee that has that fails their newborn hearing screening, that is born with a disability or a medical condition, they are referred to us. And then when they are referred to us, we send a letter letting them know that we'll be contacting them, and then we make phone calls to make contacts with those families and help them find the resources they need or connect them to another parent. And then the last one, the CBO, is our community-based organizations, and that's quite a bit lower, between 0 and 250. And those are just the different organizations that are out there in the community that can help connect us. Sometimes that's your health department. Sometimes it might be your library. It might be a school. It might be someone like Autism Tennessee. So those are the different ways that families can find us. Next slide, please. And so why Family Voices? As I mentioned before, we are family supporting families. We have all been in your shoes, or could soon be in your shoes. Maybe we receive a different diagnosis later down the line that we haven't previously had. We have 30 years of experience in the community. We have over 300 trained mentors across the state, and then we have access to a national network for challenging cases. We have a bilingual staff of Spanish and ASL, so we're a one-stop shop for families. Next slide, please. So I'm going to go over Family Voices of Tennessee programs. Next slide, please. So we are the Family to Family Health Information Center, or the F2F HIC. And so we help navigate the healthcare system, including ECF, Medicaid, TennCare, Social Security for Children, Children's Special Services, early intervention such as TEIS, and more. And then we work with families, providers, agencies, and advocacy or support groups to promote that family-centered care. And so we have, like on Facebook, we have Katie Beckett and ECF Facebook groups for families that are that we support that are using Katie Beckett or ECF. We can walk them through how to apply for TennCare, how to apply for Social Security. Our website, we have under our resource tab, we have benefits, and then we have like Katie Beckett, make it make sense, so that they know how to go through the process and what it entails. We can walk them through what it's like for that we can explain to them, one, that they can do a self-referral to have their child evaluated for early intervention. And then we're just there to support and provide that lived experience and the importance of that family-centered care. Next slide, please. Parent-to-parent support. Our parent mentors are volunteers with lived experience who receive training and provide one-on-one support. They're experts in their own journey, and they can help share what they've learned with others. I think it's important for me to mention that when we receive a parent that says they're interested in being a parent mentor or providing that peer support to another parent, we actually go through and we look at various registries, like the abuse and felony registry and such, and we check the references, and then we provide training. So they are trained on how to provide that support. We look at effective communication, confidentiality, and different things along those lines with their training before we actually, put them in and partner or match them with another parent. Next slide, please. Parent-to-parent support, we're always looking for parent mentors. If you or someone you know is interested in volunteering to be a parent mentor, please let us know or go to our website and complete the Get Connected form. I cannot express how much we rely on those volunteers, those parent mentors, and how they truly are the backbone of Family Voices of Tennessee, because they are there, boots on the ground, working with those families and providing that emotional peer support. Next slide, please. And I am going to turn it over to Merritt to talk about our Peers program.
Hello, everyone. I hope you can hear me. And my name is Merritt Holmberg, and I am a middle-aged Caucasian woman with dark hair that has a lot of silver streaks in it. And I'm very glad to meet you all. And I'd like to just, if we could get a quick show of hands for, I'm trying to understand who's in the audience today. If you are a parent of a child with special healthcare needs or chronic illness, can you put the hand raise on? Super. I think that's about 10 folks. And then people who are professionals who work in the space of helping families who have special health care needs or chronic medical conditions. That's super helpful. That's all 45 of you. Okay, super. Well, I fall into both of those categories. And I work for the Peers Division, which is under Family Voices of Tennessee. And Peers is an acronym. It looks like pears as the fruit, but we pronounce it Peers to play on the ear. And it stands for Parents, Empowerment, Access, Resources, and Support. And we specifically work with families of children who are deaf or hard of hearing. And we provide support for families all across the state who have little ones or older children too, who have any degree of hearing loss. Next slide, please. And this is my family. This is my why, how I got here. I have a nursing background, and this is my family. I have 4 kids and a heroic husband. And one of my children this is Louisa. She is now just starting high school, so she's 14 years old. But she, at age 5, was diagnosed with moderate severe bilateral sensory neural hearing loss, which means it's a problem with the nerves that carry the auditory information from the ears to the brain. And it's believed that she was born this way, even though she wasn't diagnosed until she was 5. And that's a pretty significant amount of hearing loss. And she just played along and just kind of read lips and kept up and fooled a lot of folks. And there was a lot of medical mismanagement along the way, which is why we didn't catch on to her hearing diagnosis until she was 5. And due to that, she suffers from what's known as language deprivation, meaning in the earliest years of her life, she did not have access to language fully. And she did not have all of the auditory input that a developing brain needs. And so therefore, later on, it's very easy to see the links to her academic challenges and some social challenges too, just related to her lack of language exposure when she was little. She wears 2 hearing aids now, and she loves sports. She's extremely active. She is an excellent volleyball player, plays at a pretty high level, and loves tennis as well. She's a really adventurous soul. She's enthusiastic about life in general, and she's a delight. Next slide, please. And I want to describe to you that I have, as a parent of a child who's hearing impaired, it's been helpful for me to have just the very basic information about what is hearing loss, what does it mean, why is it so important. And I caught on to this a little bit later, excuse me, later than I wish I did. And I didn't have any prior experience with anyone really with hearing loss and didn't really understand it. So I've really kind of drunk from the fire hose of information that's out there. And I like to break it down for families to help them to know the very basics about hearing loss. And we can also provide support to professionals, early intervention providers, teachers, doctors even, and about hearing loss and its implications. We can provide that information on like a more detailed, data-driven, scientific kind of manner. But I was just going to share with you a notebook that we can send to families if you can read it. It's got colorful graphics. This notebook says, "Your journey with your baby who is deaf or hard of hearing." And we can send it to families who are newly diagnosed. And it has interesting graphics, kind of cute baby blocks, playing toys, and just interesting information that is on the more basic level. And I was going to share that with you today, just some examples of the kind of information we can provide to parents who might be feeling really overwhelmed and really not having a basis of knowledge about hearing loss. And so from this slide, I'll share some basic facts about hearing loss, which is that it can range from mild to very profound. And it could include complete deafness, but there's a whole range. To contextualize the incidence of this, in the US, 33 babies are born with hearing loss every day, 95% of whom are born to hearing parents. And hearing loss is the #1 most common birth defect in the US. So I try to share these facts with parents to help them understand they are not alone. It is a common birth defect, although it is not super common in the general population. There are different types of hearing loss. There can be sensory neural, like what I shared about my daughter. There's conductive hearing loss, which means there's like an issue with the anatomy of the ear. Maybe the ear is missing, misshapen, the ear canal is too narrow, lots of different things like that. Mixed auditory neuropathy and unspecified. There's just lots of ways that hearing loss can be described. And lastly, on the slide, early identification of hearing loss with early intervention can lead to improved language skills. So we're all here because we understand, I think, the value of early intervention for folks with healthcare issues. Next slide, please. And these are more facts continued. Infants identified with hearing loss can be fit with amplification as early as 4 weeks of age. And a lot of folks don't know this. Even in the NICU, sometimes they will fit the teeniest babies with hearing aids. And that's because research is showing more and more how important it is for the developing brain at the earliest stages to have access to sound, positive, nurturing sound, their mother singing, the sound of loved ones' voices. Is just essential for brain development. And not all hearing loss, though, is present at birth. It's possible to acquire hearing loss as you get older, and causes for this could include a genetic issue or illnesses such as cancer, or sometimes cancer treatments, or a trauma. And most states require that hospitals screen babies at birth for possible hearing loss. The screening is painless. It takes a few minutes. It's done in the hospital. It's pretty quick. I'll share more about that in a couple of slides from now. And lastly, with advances in infant hearing screening and technology and family education and appropriate educational intervention, it's known that infants and toddlers with hearing loss, they do have the opportunity to develop language at the same rate as children, their peers, with typical hearing. And we can touch on that again later, but it's just, again, underscoring the importance, the vital importance of early treatment, early intervention. And we're just grateful that there are folks such as you who can help to provide that, help to be a part of that. The numbers 136 are thrown around a lot in the hearing loss world. And some of you might not know what that is. Some of you maybe have never heard of that, but you might hear of it in the future. 136 is just kind of our standard guidelines. It stands for the months, their age in months. And at each age, there are recommendations that have been made by the American Academy of Pediatrics. The early hearing detection and intervention guidelines, that's an acronym is EHDI, EHDI. That's thrown around commonly also in the hearing loss world. We really want to adhere by these guidelines. It's best practice for helping the brain to develop as it should. So at 1 month or no later than, there should be a screening for every child to understand if they can be diagnosed with hearing loss at 1 month, preferably before the discharge from hospital at birth. At the 3-month mark, the goal is for all infants who did not pass that first screening, will have a more thorough diagnostic evaluation that needs to happen at 3 months. At 6 months, the goal is for all infants who have been diagnosed with a hearing loss to be enrolled in early intervention services. And that's where you all come in, and it's really exciting to partner with you. And we want to maintain really good relationships with our early intervention partners and associates so we can all understand the importance of what we're doing. And we want you to understand why it is that we value you so much. Next slide, please. So the 136, again, is just to underscore the idea that in the hospital, the newborn screening is almost always done. It's almost always required by the state. And in fact, I don't know of a state that it's not required in, but maybe there is one. In Tennessee, it is required. And that there's a picture here and the slide where it was showing that the baby has some wires and some adhesive placed on their forehead, and it's painless, and it's called an OAE, an autoacoustic emissions test. That's the basic screening. Next slide, please. At 3 months of age, if your baby had not passed that earliest screening, there is an appointment that should happen at the audiologist, and it is a more in-depth screening. It's called the ABR. It measures the brain's neural activity, and this is a photo here of a medical professional who is assessing a baby, a 3-month-old baby, in a more thorough way. Next slide, please. And at 6 months of age, so we're at 136, if previously in the other testing, the results of the test have indicated that your baby does have hearing loss, your baby should be enrolled in appropriate early intervention services and ideally receive amplification if that's the parent's choice, or have really put resources into their dedication for sign language, American Sign Language, knowing again that the most important time for a baby's brain, the brain centers to develop is really early, and the language centers are very malleable, very plastic in the very earliest months. So giving them good access to sound, or giving them good access to a visual language such as ASL. Next slide, please. This is other information that's found in the initial parent notebook that we provide. And we are just trying to help folks understand why we keep harping on 136, why it is so important. Sometimes when I speak to parents, I call them parents who have babies who have been diagnosed with hearing issues. They want to know, what is the deal with hearing? Why is everybody bothering me about the hearing? I want to just, get used to having my baby, and can't we just deal with the hearing later? And a lot of what I'm trying to convey to the parents who have a diagnosis that, maybe they didn't expect, to help them contextualize the value, like, why is this so important? We share with them just what it does to the brain as the babies have access to communication, and what happens to the brain if they don't have access to communication in that early time frame. And excuse me, I will say that my daughter, because she did not have full access to communication at that age, we do experience a lot of complications later down the road. I can share that with families, and I'm happy to. I don't want to scare folks, but I do want to have people understand the importance of it. So we give statistics, we give common facts, such as, to remind folks that if your baby has difficulty communicating, or your child has difficulty communicating, how will he or she connect with people to get information going through life? And we like to make sure everyone understands that language is language, whether it is a spoken language or a visual language, such as ASL. The research is showing that infants who are exposed to sign language hit all of the same developmental milestones as those who are hearing. I think that is a fascinating fact. So whether it's spoken or visual, the brain receives it and develops because of it. And young children with an early exposure to a visual language have stronger visual attention skills and better vocabulary, higher cognition, language, reading, and self-regulation skills than non-sign exposed deaf children, with some reading and language abilities even exceeding hearing children who are monolingual. I think that is a fascinating tidbit too, so that folks can understand that ASL is just as valuable as spoken language. And if parents want to receive resources and want to understand how to know about that, we are happy to share resources and teach parents. And we don't, in our organization, we don't provide ASL lessons, but we can refer you to places where you can get that. This is just more about the brain in this slide, and that neuroscience is telling us that babies are born with millions of brain cells, and each brain cell has branching appendages called dendrites, which reach out to make connections with other brain cells. And the place where brain cells connect are called synapses. When electrical signals pass from brain cell to brain cell, they cross the synapse between the cell, and information that's traveled the same synapses over and over is making a pattern of neural connections, and that's hardwiring the brain. And that is how efficient and permanent pathways are established that allow signals to be transmitted quickly and accurately through the brain. And so I offer this information. Some parents are interested in it. Some parents don't really need to know it, and that's okay. And if folks want to have more specific scientific research on the development of the brain and why language is so important and why we care so much about early exposure to language, I'm happy to provide that. We have lots of resources to offer. I just start slowly with parents, and if they're hungry for more, I've got plenty more to share with them, lots of different resources, and we can share that at the end of this presentation also. I have here a graphic of two different brains, pictures of brain imaging, one that is listed as a normal brain development, and the brain has been lit up, and the majority of the majority of the brain is lit up with red and green and yellow lights, showing that it's being very well stimulated. And that is a picture of a brain that has had access to language at early years. And there is a picture of the brain that's a sensory deprived photo or an image, and it has much more dark space, just plain dark space in the brain. It's just showing less brain activity. And that is a sensory deprived brain, a brain that has received less auditory input or less visual language input. Remember, they develop the brain equally. But either way, if they've been deprived of language, this is the differences in the brain. And I'll read that new technology has allowed us to see that there are physical differences in a child's brain. That's a child's brain that's been appropriately stimulated, versus a brain that has suffered a lack of stimulation. So brain imaging is a visual way to see. And I will say that my daughter, Louisa, has participated in various studies at Vanderbilt University where they are studying the brain of somebody who has been sensory deprived. And it is a sad reality that we're still recovering from, and she's making great strides in her academic journey, but it has been a different journey than her hearing peers, or a different journey than those who were aided or had been able to use sign language in their early years, which she didn't. Connections that are not stimulated by repeated experiences in the brain atrophy or fade away. So if your brain is not stimulated early, it is kind of a use it or lose it situation. The real estate of the brain that's meant for auditory and language input, it kind of just is used by something else. It gets taken up by different uses. And no matter how much you communicate with your baby, the priority is that you do communicate as much as possible every day so your baby's brain can develop healthily into its highest potential. Next slide, please. And so those were some examples of ways that we provide parents information in their intro notebook. And then I'm now diving a little further into some of the technicalities and the data that it's available to, whether it's parents who want that, or TEIS professionals, or just different kinds of professionals. The Tennessee Department of Health is a wealth of information, and they have a really cool dashboard on their website, and there's a link to it, which we can provide later on. But it is explaining what is EDDI in Tennessee. Remember, EDDI is Early Hearing Detection and Intervention, and that's a really important focus. And it again explains on the Department of Health website the 1, 3, 6, the benchmarks that need to be met. And it explains also in 2008, Clare's Law, which is a Tennessee law, was passed requiring hearing screening for all infants born in Tennessee. And as Chrissy, my colleague, referenced earlier, our organization is contracted by the Department of Health so that we receive the referrals immediately from for every child born in Tennessee who does not pass their hearing screening and who has been diagnosed with a hearing loss. They come our way, and then I will contact the parent straight away to introduce myself, share my story, share resources, and hear from them what they would like more information about. Next slide, please. And this is getting into the data also found on the Department of Health website. And here is a pie chart and some colorful graphics. It is the most recent data available on the website is from the year 2023. And it says that there are 133 hearing loss cases in the state of Tennessee during that year, and 73 of them enrolled in early intervention. And so if you break that down statistically, that's right about half. And so it says 49.4% of those who are identified to have hearing loss were enrolled in early intervention by 6 months of age, which obviously we're 50% toward the goal of having all children who by 6 months of age who are identified with hearing loss. All children, 100% should be enrolled in early intervention. But at this point, we're at about 50. Next slide, please. And this is more data taken from the Tennessee Department of Health website. This is the newborn hearing screening and follow-up dashboard. And I like this information because it breaks down the early intervention enrollment data by the different regions of Tennessee. And I believe that these are the names, this is how the regions are categorized in TEIS, the districts. And you can see on the left-hand slide, the percent enrolled in EI by 6 months of age among those with hearing loss. And this data is from 2019 to 2023. And you can see here that South Central Tennessee, Northwest Tennessee, Southeast Tennessee, and First Tennessee, they're kind of the leaders in this, and their percentages of early intervention by 6 months of age. And you can find your location and see where it is that, or how your district is doing in terms of meeting the EDDI guidelines, the TEIS guidelines, or I'm sorry, the EDDI guidelines for 136. On the right-hand side, it just breaks the data down differently. It gives the percentage of hearing loss cases who missed enrollment in early intervention services. Next slide, please. We are providing lots of different online resources these days. QR codes are abundant. And so for families who want to connect with social media accounts, there are 4 QR codes on this slide that represent different parent support groups that are really valuable. And we offer our own, like Peers has a Facebook group. It's a closed group. It's for only folks who are known to have hearing loss here in Tennessee. And it's a great way to start. And in addition to starting with our website or our Facebook group, we can provide all kinds of links for parents who want to help their children acquire the maximum amount of language input. We have sites for families who want to learn ASL, who have questions about hearing aids versus cochlear implants, who have questions about the deaf community and wanting to join that community, which is, in many ways a culture that's very special to itself. Lots of different options that we can provide. And we also can provide many more than this. Next slide, please. And how to make a referral to Family Voices of Tennessee. You can use this QR code or go to familyvoicestn.org, and then you click Get Connected, and you can complete the brief referral form to connect with our staff and have us to connect you with a family that is very similar in their walk to yours, whether it's the hearing loss piece or all the other ways that we can make referrals, as Chrissy was mentioning earlier. Next slide, please. And Chrissy, do you want to take it from here?
Sure. So what happens next when we receive that referral, whether it be from a family member, a professional, we make contact with the family within 48 hours of that referral. We explain the services we offer. We identify a mentor that matches the characteristics requested by the family. And I'm going to stop right there and just give a little piece. If you're interested in being a mentor, know that we understand that you all are caregivers as well, and that you have a family. And so when we know that we have someone that is requesting a mentor, say someone is requesting a mentor for Down syndrome, we understand that you as a mentor, you have a child at home with Down syndrome, and there are therapies and doctor's appointments and just life. So we're going to reach out to you as a mentor, and we're going to ask you, do you have capacity right now to mentor this family? You can say yes, or you can say no, it's not a good time. We are not going to think anything different of you if you say no. We understand. We're family members and caregivers ourselves. So we get that and we understand it. We're just going to reach back out to you next time. And if you're available, great. If you're not, we'll come back to you again. But we check in with our parent and mentor after 2 weeks to ensure the match is a good fit. So we do ask that our mentors reach out within 24 to 48 hours. And then we ask them to make contact a minimum of 2 weeks, 3 months, and 6 months. And it's very rare that that is the only contact that a mentor and a mentee have. Usually they're in contact more often. But we do check in with them at 2 weeks to ensure the match is a good fit. We want to make sure that both people are happy, that the parent is receiving the support that they need, and also that the mentor feels like they are valuable and what they're providing the family is beneficial to them. And then we're going to follow up with both of them again at 3 months and 6 months to offer support. And then we're there to support forever. So it doesn't matter. A lot of times people think, oh, you're just supporting children. That's not true. We realize that children with disabilities and complex medical needs grow up to be adults with disabilities and complex medical needs. And so we're here to support you regardless of the age. Next slide, please. So if you want to connect with us, we're Family Voices of Tennessee, and you can find us on Facebook at Family Voices of TN. We're also on Instagram, Family Voices TN. Next slide, please. We're going to, the bottom has our information. So first of all, thank you for allowing us to present. Contact us if you have questions, you want additional information. If you would like to be a parent mentor, we would love to have you. Please fill out that Get Connected form. You can also email Merritt or myself, and we would be happy to answer any questions, provide you with resources that you might need, or any information that you might need from us. Next slide, please. And so now we're ready to take your questions.
I think someone had their hand raised. Ariel, did you want to ask a question?
Oop, I'm sorry. I think that was just from where we were raising our hand
From
earlier.
before? Okay, no problem. I did want to kind of mention in the chat that Ashley Bell Sievers had put a link. I believe it's to that document that you referenced earlier, Merritt, that you showed on the screen. I think someone had put a link to that in the chat, if anybody is interested in that. Also, does anyone else have any? There's no other questions in the chat. Does anyone have a question that they want to put in the chat or unmute and ask? Salome, you can go right ahead if you'd like to unmute.
I just had a question about, I think, let's see, Ms. Merritt, the statistics that you were referring to about ASL and just how much that has an impact on the brain. I was just curious if you could tell me about your source from that.
Absolutely.
Like
I even have.
Yeah.
Yes, I find this to be a very fascinating topic, and I have lined up 3 different sources. I did pull it was from Gallaudet University in Washington, D.C., and we have it available. I have links, I have hyperlinks for you available. We can send that out. If you want to provide me with your email address, I can send that to you straight after this meeting.
Yes. Should I drop it in the chat or I don't know?
Sure, that's fine. Yeah,
Christy, okay, great.
I have it ready to go. Yeah.
Does anyone else have a question for Chrissy or Merritt? Yes, Merritt. So let me put her email address in the chat for you. Okay, also in the chat, I put the FormStack link for today's meeting. Cassidy would also like a copy of the data. Darcy Barton asked, are there mentors that support families in navigating applying for family support, TennCare, or disability?
So that is something that our staff actually can support you in doing. We do have families that have navigated this process and are willing to support if that's something that comes up while they're providing that peer support, but our staff can do that. So you can fill out a get connected form on our website and just let us know that you would like to be contacted to receive information regarding this and how to navigate that. But also a lot of that information is on our website under the resource tab. There's actually a breakdown, like if you're applying for Katie Beckett, it's all of the information, all of the documents and things that you might need to apply for Katie Beckett. And we have the same for TennCare, Medicaid, and such, but we are happy to walk you through that process. We have a fabulous resource specialist, Tanya Bowman, and she is a rock star with providing with resources and information.
Okay. And also in the chat, Ashley Bell Siebers put the link to familyvoicestn.org/resources/benefits. And Jackie Campbell also put her email and address for the email address in the chat for the data to be sent to her. Kayla Rogers asked, are there resources for families that have deaf parents and hearing children?
That is an interesting question. We don't often get that question. I can refer you to folks who could be relevant to that population. We serve families who have children with special health care needs and complex diagnoses. But I know of folks professionally who can help with that, with families who have deaf adults and hearing children.
Okay. Before we go on to some more questions in the chat, Renee, did you have a question? Did you want to unmute and ask?
Yeah, I wanted to ask, I get that, Down syndrome or things that are very typical, it's probably easy to find a mentor to connect with, but what happens when you have someone that wants a mentor and you don't have someone that might fit that? Is it just a typical disabilities kind of support then, or, how do you address that? Does that make sense what I'm asking?
Absolutely. So my daughter is a very rare genetic syndrome. When she was diagnosed, there were 500 cases in the world. So I completely understand your question.
Yeah.
So what happens, we do reach out to our local mentors that we have here in the state of Tennessee, but we also ask families, are you okay if we reach out to our national partners and see if they have a trained mentor? And a lot of times that's how we find them. But also if we don't find them that way, my daughter has Phelan-McDermid syndrome. So then we can reach out to the Phelan-McDermid Syndrome Foundation and connect them with the foundation who may have trained parent mentors that can help in that case. And if all else fails, then we might look at one area. If you're interested in assistive technology per se, we will connect you with a mentor whose area of expertise is there. Or maybe you're interested in G-tube, or maybe there's just some little component in there that's really an interest of yours that we can kind of connect them with that part of it and provide that. And then oftentimes we as staff will provide that overviewing peer support to them when we've exhausted all of our resources and we're just coming up empty. Then we're there to just walk with them and support them ourselves.
One last, if you can't.
Sure.
Therapy wise, like if there's someone that's looking for a therapist to help in a certain situation, is that peer mentor, did they have any guidance on that, or they reach out to you? Like, have someone, that's looking for an OT, for example, for a high schooler, but hasn't needed it since 8, those kind of things. Do they have that kind of connection too?
Sometimes our mentors will know that, but keep in mind that our mentors are mentoring across the
parents, yeah.
state. And you might
Sure.
have a mentor from West Tennessee mentoring a parent from East Tennessee, so they're not
Yep.
familiar with those resources. But there again,
Okay.
that's where Tanya Bowman, our resource specialist, can help. But also, Tennessee Disability Pathfinder is a fabulous resource. Give
Okay.
them a call and they can look into that. But we always encourage our mentors, if you have a question like that come up and you don't know the answer, reach back
Mhm.
out to us, the staff, and we will look and dig and try to find the answers to those
Okay.
questions. So,
Thank you.
for example, I did have a family that was looking for help with rent assistance in Nashville. I don't live in Nashville, so I had to reach out and try to find those resources.
Thank you.
Okay, so also in the chat, Kayla Rogers, oh no, that's the one that we already read. Shayna Ward put a research briefs link to Gallaudet Visual Language and Visual Learning Research Briefs, PDFs, and videos in the chat. Nawan Adams asked, is it possible to get some brochures, and put their email address in the chat. Shayna Ward put another link for Deaf Mentor Program Outreach Tennessee Schools for the Deaf. That link is in the chat. And then Ashley Bell Siebers put the Tennessee tnpathfinder.org link in the chat as well. Does anyone else have any more questions?
I just wanted to get clarification from Christy and Merritt. Are you all taking these email addresses and you're going to send them information, or would you like them to reach out to your email address and ask for information and then you will send it to them? Just want to clarify that process real fast.
I have the 3 email addresses that have been requested here in the chat, but if there are others, you're very much welcome to email me separately.
Perfect.
Okay.
And I
Thank
also
you.
took down the email for the brochures, and we'll make sure that we, I'll make contact and see how many brochures we can send out. But we also have a digital version of our brochure. So if anyone would like that or any additional information, Merritt and I are always happy to answer questions and correspond with you.
Nawan Adams also put in the chat, you may be able to call 211 for resources in your area. Digital versions of the brochures would be great. Okay. Anything else anybody wants to ask? Kind of our last call for today. Okay, so in the chat, kind of up a little farther, I did put the link for the FormStack survey for today's Lunch and Learn. It was at 12:11 p.m. So you can find that there if you need to get that to get your credit for joining today. As we close out today, just remember that the next Lunch and Learn will be September 24th from 11:30 to 12:30 Central. The topic will be maximizing language acquisition skills for children who are deaf and hard of hearing. More information on this Lunch and Learn will be in the next TriStarts and staff update, so you can look for that as well. And Jackie Campbell asked, do you have the link for the digital brochure? Salome asked that she would like a copy of that digital brochure as well. I think that we are sending out, if you would reach out to the presenters, then they would send you the links for the digital brochures. Okay. Any last questions? We'll hang out a few more minutes until 12:30 to just see if anybody else has anything. Otherwise, great job, guys, today. Thank you so much for presenting for us. We really appreciate the information. And I think that's it for today. If anybody else wants to unmute and ask a question or put a question in the chat, we'll be here